Hello friends, this is your Homeopath, Dr. Sujata Naik, once more with some tips on current sicknesses, illness and how to tackle them. So some tips for all of you. And this time I bring for you some tips on how to tackle the dreaded menace, the dengue fever. Now with the monsoons on and everywhere there is so much of a spate of viral infections, and dengue is one of those dreaded viral infections which is rampant now. It is spread by the vector mosquito, the Aedes, which generally thrives on clean stagnant water, and it generally bites during the daytime. So if a mosquito bites during daytime, be careful. It could be the dengue mosquito. It could be the Aedes mosquito spreading dengue. So generally when a mosquito bites a person who's suffering from dengue and then bites another non-infected person, he's likely to transmit, it is likely to transmit the virus to the non-infected person. So just be very careful. I will give you some general tips on how to prevent dengue first, and how to recognize it, and what is the homeopathic line of treatment. So prevention is obviously the best mode of treatment before cure starts, and that is you need to first make sure that the area around your house, your own house, is free from mosquitoes. Make sure that all the pots, pans, all the buckets, the water is changed every day. Even the plant holders, you should not keep the water for more than 24 hours. Keep changing it. No bottles, water containers should have water for more than 24 hours. Keep changing that as well. Make sure that there is no stagnant water around your own house. Clean the puddles around that. Even if it is clean, you must make sure that it's all dry. So keep the surroundings very dry. Even in your bathroom, the bucket should not have water for more than maybe for a day. So keep changing that. And always use adequate mosquito protection. So all your window sills, especially if you're in an area where mosquitoes are rampant, make sure that all the window sills and all the doors have nets, so that and close them during the evening so that mosquitoes cannot come in. All young children and even adults should use mosquito repellent creams, especially in the evenings when you're going out to parks and playgrounds. So children should be adequately covered. Always wear loose, long sleeved clothes. Don't wear short sleeved clothes. Don't avoid exposing any part of the body as far as possible. So these are some of the preventive measures that you must take. Any kind of fever is risky, potentially risky, but especially dengue, because it can go into complications. So the most important step that you must take is that whenever you get a fever, however mild it may seem, don't suppress it. You can take a paracetamol if you like. There are some homeopathic remedies which I will tell you, but rest it out. It is important to rest, give your body adequate rest, have enough fluids, don't go out, don't mingle with other persons. A lot of people, because in this fast driven life, you don't want to stay back from work, you want to rush to work, you want to send your children to school so that they don't miss out on studies. So most of the mothers will suppress the fever with paracetamol, high doses of paracetamol. Nowadays you have double strength paracetamol, so the fever does come down. It seems to be apparently suppressed, and the child seems to be apparently normal, and the mother sends the child to school. But this is not what you must do. Fever is a sign, a symptom that the body is giving out that it needs rest, it needs attention. So whenever you suffer from fever, a child suffers from fever, it's a signal that you must stay at home, give your body adequate rest, have nourishing light food and plenty of water. This is one of the best treatments even for dengue. Dengue per se does not have any vaccine, has very little in terms of allopathic treatment except for paracetamol and symptomatic treatment. But in homeopathy we do have medicines which can cut down the symptom period and give you some relief from the symptoms of dengue. Now the symptoms, generally it starts like any other viral infection. High fever, headache is one symptom which can occur with dengue, but a very bad splitting headache, a lot of malaise, you don't want to get up, a lot of lethargy, weakness which is a little out of proportion to the fever, and absolutely listless and tired feeling. That is, those could be some of the symptoms and signs of dengue. But if the fever does not subside for more than 36 hours, see your doctor, who will then advise some tests, especially the dengue antigen test known as the NS1, to see whether you have a dengue fever. And even if you have, there is no need to panic. A lot of patients go into a panic mode and they insist because they hear all kinds of stories about dengue. and they tell the doctor themselves that, oh, please hospitalize me because I'm afraid. But the best place to treat dengue is at your own house. So at home, just adequate rest, fluids, complete isolation from others, sleep, adequate sleep, and just buy time. Generally, most of the dengue cases are self-limiting. By the fourth day, the fever is gone. The weakness may last for a week, so you need to take a week off from work. There are certain morbid signs which you must watch out for, and that is very bad stomach pain, nausea, vomiting which is not stopping, total malaise, and the patient is getting a little disoriented, or a headache which is not going. In such a case, the doctor will obviously advise you more tests, like especially he will watch out for your platelets, for your WBC count, and he will advise you accordingly whether you need hospitalization. But bear confidence, don't worry too much, because dengue is like any other viral fever. It's just that certain complicated cases can be fatal, but otherwise, more often than not, it's self-limiting, and you can completely overcome it just by staying at home and with basic treatment. So in homeopathy, we have I'll give you a short list of remedies which you can keep at home for fevers. Most important is BELLADONNA. So if you have very high fever with a headache, start with BELLADONNA 30C, which is a very safe potency. You can take it every half an hour till the fever comes down. If the fever goes beyond 102, 103, you can try paracetamol. But according to me, it is best not to suppress a fever. Try tepid sponging, lots of liquids, lots of fluids, and only in a young child where you need to watch out for a fever which can turn fulminant within a short time. But otherwise, most of the adults can just rest out the fever. Then the other remedy is ACONITE, where you have sudden high fever with dryness of the tongue and without too much thirst. Very dry fever, patient is not perspiring, but fever refuses to come down. So ACONITE 30C is one of the remedies. And with a lot of restlessness, ACONITE is generally with a lot of restlessness. BRYONIA is another remedy where headache is predominant, and patient just wants to lie down and wants somebody to press his head. So BRYONIA can be one of those remedies. GELSEMIUM is another remedy where there is a lot of weakness. So GELSEMIUM 30C taken twice a day, generally on the second or the third day of fever, would help. So on, we have lots of remedies for dengue, but it's a fever, it's an infection which is best treated by a doctor, and you can safely go to a homeopath for dengue. So unless there are a case where it requires hospitalization or more expert supervision, dengue is best treated at home and best treated by a homeopath. Thank you for now. Bye.